Hi everyone. Today, Melissa and I will be going over ultrasound-guided breast biopsy. An ultrasound-guided breast biopsy is a minimally invasive procedure used to obtain tissue samples from suspicious breast lesions identified on imaging studies or physical exams. The procedure combines real-time ultrasound imaging with needle biopsy techniques to accurately target abnormal tissue for pathological analysis. It is commonly performed to determine whether breast abnormality is benign or malignant. Breast cancer is one of the most frequently diagnosed cancers in women. It develops when cells in the breast begin growing in an abnormal and uncontrolled way, eventually forming a tumor. These changes often start in the milk ducts or the lobules, which are the glands that produce milk. When breast cancer becomes invasive, the cancer cells break through the walls of the ducts or lobules and spread into nearby breast tissue. About 80% of breast cancer cases are invasive, which means they have the potential to spread to the lymph nodes and other parts of the body. Although breast cancer is most commonly diagnosed in women over the age of 50, it can also occur in younger women. Men can also develop breast cancer as well. There are several types of breast cancers that can be identified through ultrasound-guided breast biopsies. Let's start off with the most common type of breast cancer, which is invasive ductal carcinoma. This cancer begins in the milk ducts and then spreads into the surrounding breast tissue. Then we have invasive lobular carcinoma. Starts in the lobules, which are milk-producing glands of the breast, and can spread into nearby breast tissue. We also have ductal carcinoma in situ. This cancer develops within the milk ducts but remains confined to the ducts and has not invaded surrounding tissue. Although ductal carcinoma in situ is considered non-invasive, it has the potential to progress into invasive breast cancer if left untreated.
There are very few contraindications for ultrasound-guided breast biopsy. In general, the procedure may not be recommended for patients who, because of other serious health problems or personal reasons, would not want to pursue treatment if cancer were found from the biopsy results. Another consideration is the use of anticoagulants or blood thinning medication. Although this was once a concern because of the possible risk of bleeding, recent studies suggest that patients taking blood thinners do not have significantly higher rates of hematoma formation. Breast implants may also require extra caution. If there is a high risk of rupturing the implant, the biopsy may need to be avoided. However, careful planning usually allows the procedure to be performed safely. Ultrasound-guided biopsy also cannot be performed if the target lesion is not visible on ultrasound and is only seen on mammography or MRI. Lastly, the patient must be able to cooperate during the procedure, since severe psychiatric or physical conditions that prevent the patient from staying still may make the biopsy unsafe. Indications. Ultrasound-guided breast biopsy is indicated for breast lesions that are clearly visible on ultrasound and require tissue diagnosis, especially BI-RADS4 or BI-RADS5 lesions. Examples include suspicious solid masses, complex cystic and solid masses, palpable ultrasound visible abnormalities, and suspicious axillary lymph nodes.
Before the procedure, patients should be screened for any bleeding disorders or allergies to local anesthetic. Fasting is usually not required, and most medications do not need to be withheld unless a provider recommends it. Now, before the procedure even begins, informed consent is obtained and the patient is educated about the risk, the benefits, and the expectations of the biopsy. A procedural tray is then prepped with all the necessary sterile supplies and biopsy equipment. The skin over the biopsy site is then cleansed using an antiseptic solution, and a sterile technique is maintained throughout the procedure. The patient is positioned to provide the best access to the lesion and improve needle visualization. Most patients are placed in a slight oblique supine position with the arm on the affected side raised above the head. This position helps reduce breast tissue depth and create a safer and more direct pathway for the needle. And depending on the location of the lesion, patient's position might be adjusted throughout. Now, as for the equipment, the primary piece of equipment that is being used is a high-resolution ultrasound system equipped with a linear array transducer operating at a 10 megahertz or higher. This allows the radiologist to clearly visualize the breast lesion and monitor needle placement in real time. A 14-gauge core needle biopsy device is commonly used to obtain the tissue sample. This needle size provides adequate tissue for pathological evaluation while maintaining patient safety. Now, additional supplies include local anesthetic, sterile gloves, sterile drape, syringes, needles, specimen containers, gauze, and a biopsy marker clip, which may be placed after sampling to identify the biopsy site for.
Filming. The required imaging for an ultrasound-guided breast biopsy includes prior diagnostic breast imaging to identify the abnormality, targeted ultrasound to make sure the lesion can be seen, and real-time ultrasound guidance during the biopsy. If a marker clip is placed, a post-biopsy mammogram may also be performed to document the clip location. Contrast media is not normally used for an ultrasound-guided breast biopsy.
Now, in this image you see here, it is a ultrasound image of a palpable breast mass on a 33-year-old patient. The lesion appears well-rounded and well-defined. It's dark in the center, which indicates that it's fluid-filled, a characteristic commonly seen in cyst lesions on ultrasound. Using ultrasound guidance, the radiologist can actually directly see the biopsy needle into the area of concern, and then it allows the tissue or the fluid samples to be obtained from the mass for further diagnosis. Now, in this image, you can see how clearly the needle has gone into the mass for aspiration, and that is why ultrasound is so important for breast biopsy, because you can actually visualize the needle going into the area of concern in order to obtain those samples for diagnosis. And this shows a successful ultrasound guided breast biopsy. This illustration here shows an ultrasound guided breast biopsy of a superficial breast lesion. The ultrasound transducer is placed on the skin surface to visualize the lesion in real time. The anatomy shown on this illustration includes the skin, subcutaneous fatty tissue, and underlying breast tissue, including the nipple and ductal structures. The biopsy needle is then advanced under continuous ultrasound guidance. This allows the radiologist to monitor the needle's position relative to the lesion and surrounding anatomy. This approach is especially useful for superficial lesions where there is a short distance between the skin and the target lesion.
Post-procedural care. Following an ultrasound-guided breast biopsy, pressure is applied to the biopsy site to minimize bleeding and reduce the risk of hematoma. A dressing is placed over the site, and patients may be advised to use ice packs and avoid strenuous activity for 24 to 48 hours. Patients should monitor their incision site for signs of infection, excessive bleeding, or worsening pain. A supportive bra may be helpful. Complications. Ultrasound-guided breast biopsy is generally a safe procedure, but the most common complications can include bleeding, bruising, pain, and hematoma at the site of the biopsy. Less common complications include infection, allergic reactions to medications or materials used during the procedure, and pneumothorax when lesions are located close to the chest wall. In patients with breast implants, there is also a small risk of implant rupture. Patients are evaluated for allergies and bleeding disorders before the procedure to help reduce risk.